Can you, first to start, give an overview of the Dell Medical MD program?
Well, I think I would probably point to our curriculum and describe that first, because that's one of the most unique aspects of Dell Medical School. And as a brand new medical school, one of the things that we had an opportunity to do was to rethink medical education. What were the challenges that physicians face today that may not necessarily be addressed with traditional medical education? And in particular, how to reinvent healthcare, and what skills do clinicians need today to not only take care of their patients, but also manage the healthcare system. And so we looked at, and I say we, euphemistically, the greater minds in medical education looked at curriculums from across the country and across the other countries as well, to see what skills do physicians need to develop and how could we design a curriculum to meet that. So the first thing that many students recognize is that our basic science curriculum is only 12 months long. And so historically, in a Flexner-like model, that would be a 2-year length of basic science education. That allows us to then use the second year for clinical education. Historically, that would be your 3rd year. Having our students go through that training in that sequence, that opens up the 3rd year to really a lot of marvelous opportunities, especially since we're part of the University of Texas, and there are so many great training programs at the university that can be beneficial for future leaders. And so making that 3rd year available for a dual degree or research activity really gives our students an opportunity to expand their skills in that 3rd year that you historically would not necessarily get in medical training. And particularly if you're interested in going on to manage or work in management in a hospital setting, you may choose to do the MBA program, for instance. And then the 4th year is much more traditional. That is when our students begin to navigate the residency selection or search process, and they may do away rotations along with additional clinical training as they continue to grow as clinicians and prepare for their 1st year as interns. We do have them go through 2 acting internships during that year. This is a level of clinical training that is a much higher expectation than a traditional level of training a trainee would experience as a student. The expectation is, go ahead.
What are some of the differences?
Well, the expectation is the level of clinical management that the person should be at the same level that a 1st year intern would be.
Oh, okay.
And so the expectation is when they actually end up on their residency, they are not surprised or shocked by the responsibility that they have, that they should have developed some of those skills already, and have the basic 5 skill sets that residencies expect them to have when they come in.